Hello, hello viewers. Today we discuss a case about generalized body pain, and a case of generalized body ache. So, what is your differential diagnosis, my dear friend? What is your differential diagnosis? At first, generalized body ache, you should think about some connective tissue disease such as fibromyalgia, and then some common disease such as hypothyroidism, hyperparathyroidism, osteomalacia, osteoarthritis, and some myositis. Myositis can be due to dermatomyositis or polymyositis, and some joint hypermobility problem. In case of Ehlers-Danlos syndrome, pseudoxanthoma elasticum, and Marfan syndrome. This is the common cause of joint hypermobility syndrome. And you should think about connective tissue disease, another form of connective tissue disease such as polymyalgia rheumatica, and another forms of muscle and joint problems such as Paget disease. So this is your division diagnosis. You should think about fibromyalgia, hyperthyroidism, osteomalacia, osteoarthritis, myositis, and joint hypermobility, and polymyalgia rheumatica, and Paget disease. This is your common differential. And then how can you evaluate this case? You should take the history. And in case of fibromyalgia, patient said about easy fatigability, and forgetfulness, and there is a non-restorative sleep. And in case of fibromyalgia, the problem is there is a decreased sleep and problem in sleep pattern. So patient cannot concentrate on anything and associate with the joint pain, fatigue. But there is, when you examine, you can't find anything. Everything is normal. But there is some tender point. In tender point patient, usually there is 11 point. We build up a scale to count these tender points. And then it can associate with other functional symptoms such as tension headache, IBS, allodynia, chemical sensitivity, early morning stiffness, and swelling of the hand. Swelling of the hand speed is not normal. And you can find any other things such as easy fatigability, disability, irritability, such things. So when a patient presented with connective tissue symptoms like fissures, but you on exam you can't find anything, then you think about fibromyalgia. And another thing associated with fibromyalgia is polymyalgia rheumatica. But this condition is associated with another condition called GCA, giant cell arteritis. And in case of giant cell arteritis, patient gives history of headache and visual problem. And age is about more than 60 years, usually more than 60 years. And polymyalgia rheumatica, then you find some joint pain, arthalgia, and joint stiffness also. And also mainly the girdle stiffness, such as the neck stiffness, and shoulder stiffness is more common in case of polymyalgia rheumatica. And other connective tissue manifestations such as joint pain can be present, but usually arthalgia is more prominent in case of polymyalgia rheumatica. And there is some muscle component, so patient gives history of muscle pain also, and also the fissures of proximal myopathy can be present. So you can find these fissures in case of PMA or polymyalgia rheumatica. And another thing is hypothyroidism. The patient gives typical history of hypothyroidism, and the patient there is history of weight gain and loose constipation and menorrhagia and voice change and sluggishness of movement, and there is a history of cold intolerance also. And when you examine, one thing is common, the jerk is diminished. Mainly the delayed relaxation of ankle jerk is present in case of hypothyroidism. And hyperparathyroidism, there is increased calcium, and this calcium causes abdominal gons, moans, and psychic gons. And so there is a history of joint pain and tenderness, and also the abdominal pain, and patient can give history of fracture, deformity, and generalized body ache. And this is the common thing in case of hyperthyroidism. You can find fissures of hypercalcemia, and also the history of abdominal pain due to renal stone can also be given. And another thing is osteomalacia. What are the history of osteomalacia? You can find usually the bony pain, bony pain, and also the body ache, and proximal muscle weakness, and bone pain, fragility, and sometimes history of fracture can be given in case of osteomalacia. And one thing is the patient gives history of proximal myopathy in case of osteomalacia. So problem occurring from standing during standing from sitting position, and there is myopathy. Usually myopathy associated with this osteomalacia. So when you examine the gait, you find waddling gait. You find the waddling gait in case of osteomalacia. And another is osteoarthritis. So patient is usually more than 40 or third decade, and in case of early onset osteoarthritis, and there is usually large joint pain such as both knee joint pain and also the back pain, also the wrist pain, and small joint involvement is not not common but not uncommon, and there is a incidence onset of a long period of time, over month to years, and it is a mechanical pain. Osteoarthritis is the mechanical pain. So when patient doing some activities, it increase, and in resting condition it is improved. In contrary to the inflammatory pain. And you can, when you examine, you find there is muscle weakness and osting, and some joint line or periarticular tenderness. You can find this some joint line and periarticular tenderness. And I already mentioned about the polymyalgia rheumatica. And what do we find in case of packet disease? Packet disease. In a case of packet disease, there is a rapid bone turnover. So bone in one side bone is forming, in another side bone is destructing to raise the blood calcium level. So in case of packet disease, so there is rapid bone turnover, and for this there is problem occur due to hearing, because of the that there is a small muscle in case of ear, that is stapedius and stapedius muscle. This will cause problem. This will cause problems, and also there is bony expansion occur in frontal protuberance, and bone expansion, and pathological fracture can also be occur in case of packet disease. And what are the finding in metastatic bone disease? There is the patient can give a history of primary bone disease, primary cancer sign symptoms such as bronchial carcinoma. Patient gives history of calf hemoptysis. And in case of prostate involvement, patient gives history of lower urinary tract symptoms. And you can find other systemic features such as anorexia or weight loss. And there can give history of pathological fracture in case of metastatic bone disease. So, my dear friends, what are the differential diagnoses of generalized bodyache? What are the differential diagnoses of generalized bodyache? You can give history of fibromyalgia, hypothyroidism, hyperparathyroidism, osteomalacia, osteoarthritis, packet disease, and joint hypermobility syndrome, polymyalgia rheumatica. This is the common differential point of generalized bodyache. And you give history of associated age condition, easy fatigability, disability. But when you examine, you can't find anything in case of fibromyalgia. And in polymyalgia rheumatica, patient gives history of headache, and also the girdle pain, mainly the girdle pain, neck stiffness, shoulder stiffness, and associated with arthalgia. But when you examine, you can't find anything in case of polymyalgia rheumatica also. And in case of osteomalacia, patient gives history of body ache, proximal myopathy, and when you examine, you can find some fracture. If there is a history of fracture or something like that. Girdle stiffness, mainly the stiffness, neck pain and girdle stiffness. And in case of osteoarthritis, there is a gives history of long joint involvement, also mainly the mechanical pain, and you can find some periarticular tenderness in case of osteoarthritis. And packet disease, there is a history of deafness, and also the frontal protuberance phase, and old age. It is the disease of old age. Packet disease is usually the disease of old age. And so, my dear friend, this is up to what we can told about the degree of generalized bodyache.